Hi, my name is Loeffler. I'm a physical therapist at On Track, and we're here today to talk about how to manage different aches and pains as they may arise during your training before they become injuries. So first of all, there's a difference between being hurt and being injured. And what I mean by that is that when you're injured, you're experiencing enough pain that you really either shouldn't be running or the pain is so bad that you really haven't been able to run. That's a very different approach to how to manage that type of a situation than when you're hurt. Now, when you're hurt, you may be experiencing some level of ache or pain, but it hasn't gotten to the point where it's really affecting your ability to be able to run. Most of the time, these kinds of aches and pains are the kinds of things that you may feel when you're first getting out of bed in the morning, or you may feel it at the beginning of your runs, but they seem to kind of ease up and actually feel better as the run goes on. As long as you can manage these aches and pains correctly, they're unlikely to become a full-blown injury and start to affect your training. The best way to manage these kinds of things is to recognize the severity of what you're feeling. If you feel that the ache or pain is getting to a point where you're feeling it throughout most of your run, then I usually start to recommend at that point that you start to take a little bit more active recovery or rest days to allow that area to get the recovery that it needs so that the discomfort you're experiencing becomes less and less. Now again, that can be taking a full day of rest and not running. It may be taking as much as a week off from your running to allow that tissue to recover. Sometimes doing more active recovery can also promote some of the healing. So rather than taking a full rest day, doing shorter runs at slower paces may be enough to help that area just loosen up a little bit, promote some circulation and blood flow to it so that it can heal more effectively. Other times you may have to start to look at other forms of exercise as a form of cross-training. So doing things like riding a stationary bike or doing an elliptical trainer. Although these exercises aren't as good as running in terms of preparing specifically for a running event such as a marathon, you're at least going to get some fitness benefit from the exercise, but you're also going to unload the area that's bothering you, promote circulation and blood flow to it, which will also help to promote some healing there. Thank you for watching. Tune in next time where we'll be talking about how to handle an injury so that you can get back to training as quickly as possible.